So in trying to get to know you, there's some public things that, make you somewhat of a conundrum to people like me, just trying to, understand. One is on vaccines, and I don't want to ask you about, all the specific theories on vaccines, but something that might be helpful is you've previously said you vaccinated your children. Just because I think this is a helpful answer, and this isn't a gotcha, I promise. If you had a child today, would you vaccinate that child for measles?
For measles, probably for measles. What I would say is my opinions about vaccines are irrelevant. I have directed Jay Bhattacharya.
Sure. No, like I said, I don't want to.
So that everybody can make that decision. But I don't want to seem like I'm being evasive.
Yeah.
But I don't think people should be taking medical advice from me.
Right. No, I got that. And I'm not asking you to give them medical advice, but would you vaccinate your child for measles?
If I answer that question directly, that it will seem like I'm giving advice to other people, and I don't want to be doing that. I want people to make.
But that's kind of your jurisdiction because CDC does give advice, right? I'm not trying to do it as a gotcha. It's just kind of.
What we're going to try to do is to lay out the pros and cons, the risks and benefits accurately as we understand them.
Okay.
With replicable studies.
Can you talk about chickenpox? Would you vaccinate your child against chickenpox?
I don't want to give advice. I can tell you in Europe, they don't use the chickenpox vaccine specifically because the preclinical trial shows that when you inoculate the population for chickenpox, you get shingles in older people, which is more dangerous.
Just one last one, just a yes or no, please, if we could. Polio?
Polio? Again, I don't want to be giving advice.
That's fair. No, that's fair. Like I said, I was not doing it as a gotcha. I was just, I thought it could be helpful if,